Thanks, Wellesley Institute, for inviting me, and Michael in particular. I'm going to begin with some anecdotes. My mother lives in Chilliwack, and she's my West Coast research assistant, the oldest and worst paid research assistant ever. But she sends me, tons of information on what's happening in Vancouver and BC. I got a phone message from her the other day saying that Surrey City Council rejected the casino on Saturday, so I went and quickly looked at the story in the Vancouver Sun online, and of course the minister in charge of gambling out there, I think his name's Rich Coleman, was sorely disappointed, as was the BC LC. And this raises important questions because I think there is a disconnect between what our gambling agencies want and what citizens want. And for the most part, gambling in Canada has been a top-down project. Canadians have had relatively very little to say on expanding gambling, and this is even the case now. I mean, this is great that we're having this discussion, but we're actually not having a referendum in Toronto, right? City Council is going to make the decision. Hopefully they make a wise decision. But if you remember in 1997, we had a referendum, and Torontonians voted against it. And here's another anecdote. I'll return to that in a minute. The Edmonton Journal called me the other day for commentary on a story there. The opposition Wildrose Party is proposing a lottery to help fund the Edmonton Oilers hockey arena. So that poses interesting problems because, of course, the Oilers are privately owned, but the government wants to actually institute a public lottery to help the privately owned Oilers. So there's no shortage of gambling stories out there. As a researcher, I'm actually quite amazed that there's room for more expansion. I think maybe 5 years ago, Dalton McGuinty said, no more expansion. Well, when governments need money, that they'll actually get back into the business. One final quick anecdote. Michael, you visited Reno. I've been there a couple times. I don't know if you noticed, Reno is not like Las Vegas. I mean, Las Vegas Vegas is obviously very glitzy and you're distracted by all the signs and the hotels. Reno's a little bit different. In between the casinos, there are pawn shops. So that's something to think about when we think about the kind of gambling that a city could have. I've spent time in Europe. When I travel, I make sure I visit casinos and look at how they're actually designed and instituted. And for example, in Stockholm and Amsterdam, you've got these small, actually almost elegant casinos that fit into the environment. They're not these big Las Vegas box-style warehouses, which is the model that we have here, and which are purely revenue-driven. And I'll talk about that more in a minute. So let me get back to the BC situation. So the powers that be are disappointed with the result. And again, as I mentioned, this raises questions of the relationship of citizens to the state. I would actually argue that, casinos are not just tax revenue generation, but actually mean a different kind of state relationship to the citizen. And that's one of the slippery slopes that we need to think about that usually does not get talked about with expanded gambling. There's actually a very recent book out called Gambling for Profit at U of T Press, and it talks about gambling expansion globally. And gambling expansion in the last 40 years, and certainly in the last 20, it's typically a response to economic situations, either financial crises, economic downturns, or whatever. In other words, gambling expansion is always an economic policy. Okay, and I would say that the economic aspect typically outweighs everything else. And in Ontario, we have a revenue-driven model. The OLG takes its orders from the Ministry of Finance. The Ministry of Finance wants the OLG to increase its revenues over the next 5 years to the tune of about $3 billion. So our model here is stimulatory. It doesn't have to be stimulatory. You don't have to stimulate gambling, but it's stimulatory, okay? And that's because it's a revenue-driven model. I don't know how many of you actually watch TV or TV in prime time. I make a point, I'm thinking of doing some work on gambling advertising. The Canadian channels are inundated with gambling ads, and these are from the government. I find this somewhat problematic. So we have a revenue-driven model here. What's the economic context? As everybody knows, Ontario is deeply indebted. Last time I checked, $240 billion debt. We have a deficit of about $14 billion. OLG's revenues are declining. Fewer Americans going to the Canadian casinos. So it's kind of interesting, you know, it's sort of an odd policy to be expanding it in an economic downturn. I mean, it completely shows the economic and revenue interests. So I think, as Rick mentioned, or perhaps Michael, it's not just the issue of the casino, but as well, the OLG wants to move into online gambling this year. So this is a major shift in increasing gambling in Ontario. And I have a bit here from one of the full-page ads the OLG has taken out. This was from the Star. At the bottom, it says, "Modernizing lottery and gaming for a better Ontario." Ontario's not that bad. The euphemisms are always interesting to me. I can easily, more gambling for a better Ontario, or since it's questionable as to whether gambling actually does anything, I'll just say more gambling. All right, so let's look at how gambling researchers have thought about what's going on. We have two models, the Alibi model on the left, the risk model on the right. The Alibi model is sort of the early model, and these two models sort of characterize gambling in general, not just Canada, but we're talking about state-owned gambling here. So the Canadian model sort of straddles both, even though we are increasingly on the second half under the risk model. In the Alibi model, the government gets into gambling largely because it can claim public benefit, but here gambling is still problematic. It's still a stigmatized activity. And just, I can date this to, say, pre-1985, and I'll say why in a minute. So in the Alibi model, part of the interest is to curtail illegal markets, right? The claim is to take gambling out of the hands of organized crime. I like to say, though, that the organized crime could only dream to spread gambling the way governments have. So that definitely is an alibi. There are other related matters. Casinos always attract various forms of crime, including money laundering, of course, and there have been some high-profile cases lately in Ontario. And in the Alibi model, gambling should not be for private profit. That's sort of the Canadian way also. I think, when they legalized, this goes back to actually Trudeau in the 60s, right? Lotteries became legal in 69. I think it was Bill C-150. And the impetus was to fund the 76 Olympics. And even though at the time, Trudeau previously been talking about getting the state out of the bedrooms of the nation, it's actually interesting how with gambling, it wasn't a removal from an activity like gambling, but rather the takeover. Not a withdrawal, but a state takeover of the activity. And that seems to be the Canadian way, right? The state takes over the sins. And you could call it paternalist, you could call it bureaucratic statist, whatever. I'm not necessarily convinced now that that's actually a good way for things to be organized. But it seems un-Canadian that gambling should be in the hands of private industry, although there are rumblings out there that things like the LCBO and the OLG should be taken out of the government's hands. So this is a Canadian model, and the idea is that it should be for public benefit. In 1985, the federal government hands control of gambling over to the provinces, and there's a phrase in the criminal code that permits lottery schemes to be legalized, and the governments, provincial governments, take full advantage of that term to expand all manner of gambling. So this really gets going. The gambling expansion we have now really gets going in the early 1990s, right? You've got casinos, you've got electronic gambling, you've got sports betting, you've got scratch and win. So this, 20 years ago, I would say, in the early 90s, gambling really starts to expand. That takes us to the second half, the risk model. And I would say that's the model we have now, right? So gambling as an activity is not stigmatized the way it used to be. The activity in itself has been legitimated, you might say. That's not to say that there aren't social conflicts. We're here because there are still social conflicts. There is a stigmatized gambler, of course, and that is the problematic gambler. So there's a shaping of the way governments want us to think about gambling. So in the risk model, gambling is seen to be a legitimate business, but since we're Canadians, it can't be legitimate business for business. It's legitimate business for the government. I would actually say, I mean, you know, up until casino expansion, the only places you could really legally gamble in Canada were bingo halls and racetracks and church raffles. So if you want to gamble legally in a casino, you have to do it through the government. So actually, you could say, you could make a case, and this case has been made, that what we have is a partial liberalization or a selective liberalization. In other words, there's still a residual sense that gambling is problematic and that the state should be in control of it. I suppose if it was fully liberalized, we'd have just free market gambling everywhere. Within this gambling's legitimate business frame, you've got the entertainment framing. Okay, gambling is just another form of entertainment. That's certainly, you know, how it's depicted in the TV commercials. As a sociologist, I question this. I wouldn't say gambling can't be entertainment, but what you have to do is to shape the potential gambler to view gambling as entertainment, because gambling involves risk. Gambling can create certain kinds of problems. So the entertainment framing is important for the government to have citizens view gambling in this kind of way. And certain interesting problems arise as a consequence of this type of framing, and I'll get to those a little bit later. The model is revenue maximization. Okay, the model is revenue driven, as I just mentioned. The Ministry of Finance wants the OLG to come up with $3 billion over the next 5 years. Well, that's a stimulatory approach. How is it going to do that? The objective is to maximize revenues, and I mentioned that the government's going into online gambling. It is interesting how, you know, with activities, you know, governments can have sort of a cautious or a moral position on it, which they seem to have before on online gambling. Now they don't. Okay, now they want to jump into the online gambling market, and they're just going to be a competitor in the market, right? In other words, rather than regulate it somehow, and of course it's very difficult to regulate, and instead of saying, okay, we don't want our citizens to face these potential risks, easily accessible gambling online, we're just going to jump right into the market. Why? Because we're losing revenues to Poker Stars or whatever the other sites happen to be. So the government just becomes a market participant. So an issue for us is, well, what exactly is happening to governments when they act in this way? So generally we go from gambling to gaming, which is another way to think about how gambling is tamed, if you will, turned into a form of entertainment, just like everything else. You know, the OLG is the Ontario Lottery and Gaming Commission, not the Gambling Commission. What are some of the issues and tensions that arise from the risk model? The state is both the regulator and the promoter/beneficiary. That's a major issue, right? That's called a conflict of interest. And I think in a lot of ways everything follows from this conflict of interest, especially if we're talking about a revenue-driven model. can you regulate yourself while you are also the promoter and the beneficiary? Well, the issue of the public good then becomes problematic in this type of situation. So this is one of the major issues that we face with state-owned gambling. Another tension is finance versus public health, right? The revenue interest versus the public health interest. David's going to talk about the Toronto orientation. I was thinking, I wonder what the Ontario Ministry of Health's position is on this, and I bet you they're not going to say too much about it, although in this full-page ad, you've got the list of things that the Ontario Ministry of Health is actually funding. So in other words, the Ontario Ministry of Health is following the Revenue Ministry of Finance lead. Steve mentioned the amount of percentage of revenues coming from problem gamblers. 4.8% of gamblers generate 36% of revenue. This study was a Canadian study funded by the Ontario Problem Gambling Research Centre. So 4.8% of gamblers are contributing more than a third of $4 billion when this study was done. And these are findings we find across the board, okay? The problem gamblers are the casino's bread and butter. They're the best customers. Canada Safety Council estimates 360 gambling-related suicides per year, almost one per day. Electronic gaming machines, slot machines, and VLTs, which are video lottery terminals, have the highest rates of addiction. If the OLG is doing something right, they're keeping these machines out of everywhere. Just anecdotally, I flew into Halifax 6-7 years ago, and when I got to the terminal, I was shocked at how many VLTs were actually in the airport. It was actually very depressing to me, because not only did I see desperate people on them, I was thinking, man, this is a desperate government to actually put them into the airport like this. I like to say that the least risky form of gambling actually brings with it the greatest risk, right? From my point of view, well, first of all, I don't think slot machines are gambling, right? They're not gambling. They are programmed to pay out a certain percentage of money. If you play them, you're going to lose. You could actually might say the biggest risk is winning money, right? Because they're actually programmed to lose money. But ironically, they create the greatest risks. You have the highest levels of addiction with the electronic forms of gambling. They're the most addictive. You can lose thousands of dollars in an hour. These are very sophisticated machines, and some interesting research has been coming out about the design of addiction into the machines. I can give people references on this later. Some more issues and tensions. I'm just going to go through this fairly quickly. Casinos are open 24/7 versus restrictions on alcohol, even if the government's running it, right? In other words, we have the LCBO. There are restrictions on when you can buy alcohol. You've got to be out of the bars at 2 o'clock in the morning, but you can leave the casinos open 24/7, right? Governments are doing this. Why? Because they can, and this also is a reflection of the revenue interest. It doesn't actually have to be that way. Gambling, from my point of view, is a form of taxation. It's an interesting, problematic taxation model. It's a form of stealth taxation. And, the government will say, well, if we do think of it as taxation, it's voluntary. And some people will say, well, the money goes to hospitals. And then I would say, well, do you think hospitals should actually be funded on gambling money? Think about what that actually requires, right? You need to continue to stimulate gambling activity, and a gambling economy needs to constantly be stimulated. It needs to be constantly stimulated. That's why we're talking right now, right? Declining revenues, the gambling economy needs to be stimulated, and it only really works if you bring people out of the local environment. Otherwise, it just sucks all the money out of the local environment. You need tourists to come in, and that's the claim. Another example of the stimulation are these scratch and win games. If you're paying attention, they're constantly revolutionizing these scratch and win games, right? They had rock, paper, scissors. They had the new black, whatever that was. I'm still trying to figure out what the new black was as a game, but that's what it was called. So they're constantly trying to stimulate the products to keep people interested in the games. Responsible gambling is one of the methods to, I would say, legitimize gambling. I have problems with this. I have problems with the responsible gambling model. Just quickly, in Europe, responsible gambling is aimed at the provider. It's aimed at the provider, providing safe products and regulating how casinos are open and these kinds of things. In North America, responsible gambling is aimed at the individual. That's an interesting way of thinking about how the state looks at us as citizens. I actually don't think they look at us as citizens. They look at us as consumers. So between voluntary taxation and responsible gambling, you've got an individualization of the state's relationship to the citizen. So the state, with the revenue-driven model, the state or the government, I prefer state because governments come and go, right? Casinos become part of actual infrastructure. The state becomes an actor directly in the market. Rather than regulating market activity or potentially dangerous products, it acts directly in the market. So increasingly, it acts more and more just like a corporation in wanting to stimulate gambling. So that raises questions about, well, what are governments actually supposed to be doing? It relates to the conflict of interest I mentioned earlier.
Most of what I'm going to say comes from a report that we published in November on the health impacts of gambling expansion in Toronto. Although my name is on these reports, of course, they're collaboratives. In this case, it was a number of my staff, including Lauren Vanderlinden, who's here. Yes? One of our CAMH colleagues is there as well. That's great. So we collaborated with the Center for Addiction and Mental Health Problem Gambling Institute, who know a lot more about problem gambling than we do, and did a joint report. The reason why we did it is because I think this is an important public policy issue that has health implications, and we think there should always be a health dimension to public policy decisions. If you're thinking about healthy public policy or health in all policy approaches, this is an example, which is why we inserted ourselves into the debate. The report includes a number of different things. It includes a review of the scientific literature that was available on the impact of gambling on health. It includes some new analysis of Ontario data on the prevalence of gambling behaviors. So we brought that forward. And it tries to reach some conclusions about what sort of health considerations should be part of the discussion of a new casino in Toronto. So you've already heard a little bit about the OLG's strategic business review and their attempts to modernize lottery and gaming in Ontario. That's why we're here, because among the many changes in the landscape of gambling in Ontario that the OLG wants to bring forward, and the government has said will bring forward, includes a casino in the Greater Toronto Area. You hear a lot about video lottery terminals. As far as we understand, that is not a part of their plans currently. There are other provinces that have video lottery terminals, but that's not currently in the cards for Toronto or Ontario. The process for establishing a casino, one of the features of this new plan is that OLG wants to more completely privatize the operation of casinos. So OLG will at some point solicit business cases from private operators. They say that they will only proceed with municipal support, which is why City Council is going to be considering this issue. I've also heard OLG say that there will be a casino in the Greater Toronto Area, so I'm not sure how to square those two things. If all the municipalities say no, then presumably there won't be. However, there is a requirement for municipal support, and municipalities are required to consult with their residents, which is what's been going on to some extent, with the exception of not having a referendum over the past few weeks. The OLG's plans have set certain zones, certain geographic zones for casinos. The ones that are relevant to Toronto are the waterfront and the area of the Woodbine Racetrack, which is already a site for a large number of slot machines. It's distilled out to these locations, which are being actively considered currently by the city and by OLG. That's important because some of the discussion is going to concern whether or not there should be a casino, and the other part of the discussion is, if so, where. So these are the benefits that you've heard that the province has put forward in terms of why we should have an expansion of gambling, why we should have a casino. The debate is revolving around two scenarios. One is a standalone casino, and the other is what the proponents are calling an integrated entertainment complex, which would be a casino and a lot of other things in one place. And they like to talk about the integrated entertainment complex because it takes the focus off the casino and makes it into something which sounds more broad in terms of economic development. All of these things are subject to some degree of discussion and argument. Probably the biggest argument which has come out in favor of this, apart from the actual flow of cash between the casino and the City of Toronto, and there would be some amount of money that the City of Toronto would get directly as a hosting fee, has been around job creation and employment. So there's a lot of debate about that, about how much, what kind, is it good, is it cannibalizing jobs in other sectors? Whether this is a catalyst for economic growth is another hotly debated point. The consultants that were hired by the city to do some work on this gave the answer yes, without qualification, which is interesting. And a lot of the public debate has been about whether that's really a fair assessment of what would happen. In terms of harms associated with the casino, when we decided to look at the health impacts of gambling expansion, we had to make some choices. And in this report that we put out in November, we chose deliberately to focus on problem gambling. The reason for that is because on our assessment of the science behind this, it is the most direct and largest impact on health. There are lots of other potential impacts, and some of those were explored through the Wellesley's health impact assessment, whether or not there will be a burden on social services, whether or not there will be an increase in crime, whether there would be an impact on a negative impact on the local economy, whereby local businesses would suffer as a result of competition. There's issues around traffic and how that might affect injury rates and motor vehicle accidents. So there's a lot of other things that happen, but we chose in this report to focus on problem gambling, partly because we thought it was the biggest and most direct, and partly because we thought that's where we would have the most credibility in terms of contributing to the ongoing debate. So what is problem gambling? Well, problem gambling is gambling which is harmful. It's certainly possible to gamble without harm. Many people do it. For them, it may be a form of entertainment, but there is a subsection of the population for whom gambling becomes problematic and reaches a stage where it is interfering with their health, their job, their lives, and the lives of their family and friends, and has a broader impact on the community. So how do we measure and understand problem gambling? There's a couple of ways to do it. There's a problem gambling severity index, which was adapted into a module in the Canadian Community Health Survey in 2007-2008. That was the data that we used in our analysis of the prevalence of problem gambling in the Greater Toronto Area and Ontario. And what we came up with when we looked at the prevalence of problem gambling was not terribly different from what's already in the literature for other jurisdictions. There have been other estimates that are made other than ours that suggest the prevalence of problem gambling. Problem gambling exists on a spectrum like many other addictive behaviors. So the most severe and moderate risk problem gambling, typically between 1 and 3 or 4%, is what the literature shows. In our analysis of the CCHS data, we found that the most severe form of problem gambling, that's at the very top of the severity index, affected about 0.2% of people in the GTA. But if you go down to the next rung of sort of moderately at-risk problem gambling, you add another 3% or so. So we end up in the same range that other researchers have found. One of the reasons why we wanted to isolate that most severe form is because those are people who are most likely to suffer health impacts as a result of their problem gambling behavior. Of course, problem gambling doesn't just affect an individual. This is a graph which suggests the full range of the health impact. With individuals, there are impacts on physical and mental health. There's a strong association with other forms of addiction, including substance abuse. And of course, there are impacts on social determinants of health. So people who experience financial hardship and social isolation may experience health effects from that. Many of those impacts spread out into family and friends. There are family breakdown, relationship breakdown, family violence, family poverty, and of course there are broader community impacts as well. So it is often estimated that for every problem gambler, there are about 3 or 4 other people who are negatively impacted, and I think we can say that that is true for health impacts as well. Here's just some of the data that's in the report. Self-reported health is a very good general indicator of health status. and so is self-reported mental health. So you can see there is a gradient between problem gamblers, lower moderate risk problem gamblers, and non-gamblers or non-problem gamblers. A pretty clear gradient both for self-reported health and for self-reported mental health. So gamblers tell you that they're less healthy, and they tell you that they feel less healthy if they're reporting of actual health problems. Physical health problems by gamblers is much higher than in the general population. Financial problems, again, social determinants view, obviously is much more prevalent amongst problem gamblers. Suicide is something, as many people have said, is associated with gambling. The research can be difficult because it's often difficult to identify specific suicides that are related to problem gambling behavior. But the patterns of suicide and the relationship with gambling, I think, is broadly seen throughout the research and should be considered a significant public health problem associated with problem gambling. So what we concluded from the literature in relation to the matter of a casino in Toronto is that problem gambling does tend to increase with both availability and proximity. And I think there's some parallels with the research findings on alcohol. If you make alcohol more available in a community, problematic alcohol use increases. There's very strong evidence of that. The same is true, although the evidence isn't quite as strong with access to gambling. There are a number of different studies in the United States, in Canada, and New Zealand, which show that there are more problem gamblers the closer you get to a casino. And they've looked at closeness is important because we're talking about a fairly small area in the GTA. Those studies range. There's some that show that if you're close, as in closer than 50 or 80 kilometers, it's higher. But there's also studies that show that close, as in within walking distance, makes a difference compared to having to drive. So there is an availability or proximity closest. Now, currently, the closest formal casino is about 80 kilometers away from Toronto. There are slots at Woodbine, but it's not a full casino. So it would be a big change to have a casino right within the GTA. There are equity considerations, as have been mentioned. There are groups that are more likely to experience problem gambling, including young men, people with low income, Aboriginal people. So who's nearby makes a difference. Now, in the Greater Toronto area, we have vulnerable populations really throughout the community. So I don't think there's any place you can put a casino which is far enough away from vulnerable populations that you wouldn't have an inequitable impact on problem gambling. So all potential sites are a risk. The size of the impact is hard to predict. The range in the research studies are from zero. There are some studies where a casino is opened and the problem gambling rates have not gone up, and there are others where the problem gambling rate has doubled. So if you go back to the original data, you could see tens of thousands of additional problem gamblers in a worst-case scenario with the introduction of a major casino in Toronto. How to decide where we are in that range? Like, are we going to be closer to zero or closer to a doubling? I'm concerned that we may be closer to a doubling for a couple of reasons. Because we have a lot of vulnerable populations within the city and within the metropolitan region. And also because right now our baseline rates of problem gambling are relatively low, particularly for the most severe form. That 0.2% is lower than Ontario as a whole at 0.3. And if you look at Ontario gambling rates, they are generally lower than provinces which have more accessible gambling. The Western provinces have much higher rates of problem gambling than Ontario does. So we've got room to grow, if you like. I think that is a problem for us if we're going to try and increase access to gambling. I'm sure that's part of what the thought is, that there is room, there's market room to grow from the province's point of view. A couple of issues that come up in this question of siting is that it doesn't matter where the casino is because anybody can gamble on the internet. And that's true. You know, your gambling is as close as the laptop in your basement. However, the research suggests that internet gambling is a bit of a different animal. First of all, it's one of the least prevalent forms of gambling. So many more people particularly people who have problems with gambling, go to casinos, buy lottery tickets, and indulge in other forms of gambling than internet gambling. There are people who have problems with internet gambling, but I don't think it's accurate based on the research that I've seen to suggest that a casino doesn't make any difference if people have access to internet gambling. Secondly, we've essentially said that closeness of a casino makes a difference But if there's a casino anywhere in the GTA, it's probably close enough to have an impact on people in Toronto. So I can already hear, and I have heard some of the decision makers talking about, well, if there's going to be a casino in the Greater Toronto Area, we might as well host it because we're going to get the downside anyway. We're going to get the risks, so we might as well have the good to offset it. I think that's an ethical issue. I think, to say that if there's a casino, some people are going to get hurt, and if somebody has to benefit, it might as well be us. I don't think necessarily is a principled stand to take. But I can already hear the justification in people's minds for why we should get the benefits if we're going to get the risks. What we concluded in the report and what we said to the Board of Health was that there are going to be negative impacts if there is an expansion of gambling in Toronto. Those negative impacts are going to occur regardless of where the expansion occurs within the GTA. However, they're going to have a bigger impact on closer communities. And I think that's a fair reading of the science as we understand it now. And the Board of Health, we basically, I said that this really should be an important part of any decision to establish a casino or not in the city. The Board of Health took it a step farther and said, based on health considerations alone, if we were only think about health, the answer should be no. So the board is already on record. At the same time as the report was brought forward, we brought forward a position statement on gambling and health, which is kind of a summary of the science. It talks about the relationship between gambling and public health, and says that the best way to reduce the health impacts of gambling is to limit availability. It was a similar approach that we take with alcohol. The media who reported on this kind of skipped that first statement. They were interested in the next part, which was about the 10 things that you could do if you were going to have a casino to minimize impacts. Now, these 10 things, even if you did all of them, is not as good as not having a casino at all. That would be the first choice. But if you are going to have a casino, there is some science behind operating it in a way which would minimize the likelihood that problem gamblers are going to get into trouble. Now, all of these things, these 10 things, are based on sort of best practice recommendations. Very few of them are in place in Ontario casinos. The OLG did publish kind of a rebuttal to this in which they talked about all the things that they're doing. And OLG likes to talk about how they are leaders in responsible gaming. Thanks. But you can see from what Jim said that this is really a conflict issue for them. All of these things will reduce revenues. And we've seen the same data that he referred to that suggests that a significant portion, about a third of revenues, come from problem gamblers. For some forms of gambling, for the most problematic forms, like slot machines, the general category of electronic gaming machines, the researchers tell us that the percentage is perhaps 2/3. So it's a very significant contribution. So all of these things, by virtue of the fact that they may actually work to reduce problem gambling, would also cut into revenues. So many of these OLG is quite resistant to. Some they are talking about how they're planning on doing something in this area, but they're really not there. As I say, first choice, don't expand gambling access. So access controls really are probably the best public health strategy, but all of these things could be of some help in existing facilities. So what's happening? The Board of Health did ask us to look at other aspects of gambling expansion which may have an impact on health other than problem gambling. So some of the things that Steve looked at in the health impact assessment we are now looking at. It's going to be more difficult for us to report on those in the kind of detail and with the kind of quantitative findings that we did on problem gambling, but that's going to go to the February 11th Board of Health and will be available to City Council when it makes its decision. As you've heard, the consultation ends January 25th. That's the last day that you can submit something electronically on the website. The formal public meetings have already happened, although there are some city councillors who are hosting their own ward-based meetings, so there may be opportunities if you're in another part of the City of Toronto. The City Manager will report with recommendations to the Executive Committee on March the 20th, and City Council's decision is expected at its meeting on April 3rd and 4th.
David, in terms of access and availability, we talked about proximity in terms of mileage. Does access, I'm interested with the TTC or accessibility so easy rather than getting on a bus and going to Rama, did that have any effect or would it have any effect?
Yeah, in the research studies that we looked at, accessibility, including transportation access and physical distance,
makes a difference. And it's one of those things, I don't think that either with alcohol or gambling this is necessarily intuitive for people, because we have this model that it's the individual who has the problem. And if they've got an addiction, they're going to find a way to get access to either the alcohol or the gambling, no matter what we do. But we know from, in both cases in the research, that availability controls do work, and they make a difference. So it's a dilemma for a government that wants to make more money, to say we want to reduce the availability. There aren't any other marketers who restrict the access to their product voluntarily, right?
Yeah.
So the conflict that Jim describes is very much there. And I think, as I say, it's not necessarily an intuitive thing. There was Giorgio Mammoliti, who's a city councillor, made a very creative suggestion for one of the benefits of casinos. He suggested that it would be a suicide prevention initiative, because it would flush out the problem gamblers and we could identify them and help them, right? So people's thinking about this is not necessarily rational, I think, in a lot of ways.
Can I just comment on that? I mean, the idea of flushing out the problem gamblers is interesting, because problem gamblers are made. They're not essential categories of people. You actually create them by how you actually structure the gambling product. I actually think anybody can become a problem gambler.
Yeah. I don't know whether that's true or not, but it is true that people won't become a problem gambler unless they have exposure to it's the host agent environment, kind of the traditional epidemiologic triangle. You have to have the exposure. And similar to tobacco, where we know from tobacco industry documents, a lot of work was put into trying to make tobacco products more addictive, right? In fact, that's exactly what happens with the design of games. And one of the reasons why electronic games like slot machines and VLTs are more problematic is because they have features in them which are designed to keep people at them, betting longer, spending more money. And one of the 10 recommendations for mitigation is about the design of those machines. Slot machines which give you the impression that you are influencing the result because of the way they're designed, because you think you're stopping the things from turning, or you have a sense that near misses where you have a sense you almost won, are really contributing to people's false beliefs about probability. It's interesting. You told a story about your mother. I'll tell a story about my mother. My mother was in Las Vegas recently, and because she knew we were working on this, she brought me a bunch of responsible gambling pamphlets, which were funded by the gambling industry, but developed by an independent researcher, and they were actually really, really good. Mm-hmm. But she found them on the back rack of, when you go into a hotel, all the tours and stuff are there. There's somewhere in the back there were these pamphlets. If you actually read the pamphlets, it listed the odds of winning for every game. It listed, what percentage of your money you could expect to lose, depending on whether you were playing blackjack or a slot machine or whatever. It was very, very good. It took on the issue of a clear understanding of probability very directly. So if anybody actually read it and believed it, it would be good information. But I have a feeling that it plays almost no role other than to allow the casino to say that they're doing something about responsible.
Yeah.
So just picking up on the theme, I wanted to jump in and just pick up on the theme that instead of identifying the problem as being irresponsible gamblers, but the problem is the real problem gambling is the government that's addicted to gambling revenues. Jim, I was struck by a comment you made that in places, I believe you mentioned Amsterdam, where and perhaps one other European country where responsible gambling, the focus is on the provider. So what is the actual state mechanism? How do they deal with the inherent conflict the state has? On the one hand, regulation, but on the other hand, revenue generation. And this is the big issue. Where do they have a way of, in effect, inoculating the regulator from the revenue side of things?
Well, all the governments are interested in the increase in revenues. My other example was Stockholm. I was at a conference a few years ago, and one of the speakers was one of the higher-up people in Svenska Spel, which is the Swedish gambling corporation. And his whole modus operandi was to get more people 18 to 30 to gamble. In fact, he was trying to recruit the academics to help them to get more people to gamble. I found that to be a little bit problematic. So the interest in revenue is there. But to give another example, in Amsterdam, And this actually speaks to David's lists of things you can do to try to mitigate problem gambling. They ID you, they ID everybody, okay? Here we have this open door policy. Anybody can just go in and gamble. Not only do they ID you, but they charge you a fee to get in. That's important, right? In other words, you would prevent a lot of people from going in by saying, you want to come in, it's $20 or whatever it happens to be. You know, the OLG will say gambling is just like entertainment. Well, or like going to a movie. Well, you pay for a ticket to go see a movie. So you have these analogies. So that's just one example, right? You could have admission to the casino designed in a different way. In other words, in that particular case, it's not as baldly revenue driven, right? There is some attention to, okay, how do we prevent the problem gamblers from, potential problem gamblers from, getting out of control or whatever. So yeah, it's a very conflictual idea, but it is driven. To give you the online gambling example, okay, I mentioned that the government's position is, we're just losing all this revenue to all the other sites. I call this jump in the lake public policy. If you jump in the lake, should we jump in it too? Yeah, we'll jump in the lake. We'll jump in the lake too. So what follows from that revenue kind of interest?
So I want to, before the meeting started, I was having a conversation with one of our participants. I won't single her out to embarrass her. We were talking about youth and the youth perspective. One of the things that struck me about the current debate on casinos is it seems to be two sides. One side saying this will be good for you, and the other side saying this will be bad for you. But I don't know if we're necessarily reaching down. And I wonder, David, in terms of the mandate you have now around expanding your analysis of the health and social impacts, what processes might be possible to sort of engage more people in this conversation? Because I suspect there are a lot of people who have some intelligent things to say, but our consultation process seems to have been perhaps not as fulsome as it might be. Any thoughts on opening up the process more?
Well, we don't have a mandate at the moment at the Board of Health to conduct our own independent consultation process. I think the consultation process did surface lots of community concerns from all kinds of people. They also surfaced some people who are interested in having a casino. So, there has been a critique of the process that the city put in place. But I don't think it was bad. I don't think there were major views that were unheard. And I think that's going to continue. I think that there's going to be active lobbying of city councillors. I think there's going to be lots more media discussion. And as I say, some of the councillors are holding sort of local meetings in their own wards to get more of a local community perspective. So I don't think that it's necessarily that we have a huge gap. I think it's just the way the decision is structured. City Council is going to have to turn down quite a bit of money if they're going to decide that the harms of a casino are more important than the benefits.
Which sets up, again, the essential conflict in this discussion, which is on the one hand...
Well, it's entirely possible the harms could definitely cost more than the benefits.
They might not cost the city more, so you have the issue of attribution.
Why wouldn't
harms and benefits? Well, because probably the province would have to pay more of the costs.
So, like policing, the province would pay for?
Well, I was thinking on the health side.
Yeah, but there are other costs aside just from the health side.
Yeah. Well, the official position of the Toronto Police Service is that there will not be any additional costs if there's a casino in Toronto. That's what they said as a part of the
I don't know, there's been 2 shootings outside Vancouver casinos in the last year, so...
Yeah. Just saying
aside from things like money laundering and that kind of thing.
Yeah, well, I was a bit surprised when they came to that conclusion, but that has been their view.
Yeah.
I was interested in your sort of comments or observations on the LG ads that have been coming out, and I was at an Argo game with my family, and my husband got handed one of those condom package, questionable things, and so it was in the midst of doing our work for our report, but when I was attending one of the consultation sessions, there was actually a city councillor who raised her observations about the new marketing, and it seems to be sort of selling more lifestyle, as you commented at the beginning. And I wondered if that is based on any academic research out there, or is it sort of just the sense that this is kind of the way to open up a new market, is to get the sort of cohort that isn't yet affected by it, and to get them in to be the gamblers who could increase revenues and perhaps buy gambling responsibly.
Yeah, the condom ad is definitely aimed at a younger cohort, which raises issues in and of itself. I guess with the advertising, you work in terms of volume. I mean, I mentioned the ads you find in the TV in prime time. I haven't, this is something I'd like to, there's been a lot of work actually done on advertising, but not a lot of it is what I would call semiological, like analysis of the actual images and signs that they use in the ad. There's a lot of content analysis, for example, and a lot of the ads are about, winning the lottery jackpot and that kind of thing. Interestingly, lately we are seeing more ads, and this is because the OLG wants to expand gambling right now. We're seeing more ads about the social good that gambling does. Not just the ads that get you to go do Proline or go to the casino, but you are seeing ads on TV and in the newspaper, I mentioned the full-page ad, that promote the social good that gambling is doing. So there's definitely a PR, strong PR going on out there, painting, the picture of the public good, and for me that's very questionable. A gambling economy is very questionable for a number of reasons. We could just raise this issue. Let's say Toronto does get a casino. Well, what's next? We're in an economic downturn. They're trying to stimulate it more. Will that ever potentially stop? I try to take a macro perspective on these things. There are a number of things that have to be in place for gambling to be legalized. One is just culturally, a less religious resistance, for example. But since we've seen gambling expansion, since the 80s, what's been happening in economies, right? We've had deindustrialization, we've had globalization, we've had neoliberalization. Gambling is almost the perfect policy for this kind of context, right? In other words, if you take manufacturing as an example, and Ontario's been hit hard, as has been many states in the U.S., provinces in Canada have resorted to gambling to kind of make up for the loss of manufacturing. So we go from making things in the old economy to swishing money around in a new financialized economy. That might seem kind of speculative, but frankly, the federal government has announced that they're deferring their balancing of the federal budget by a year. Governments are finding it very difficult to manage their own economies. Gambling plays a role in that, right? And I like to say, in this context, states become successful at selling risk products to their own citizens, right? They have difficulty managing their own economies, right? But gambling somehow becomes a policy that they become successful at. I don't know if that answers your question, but
Question over here and then one on this side.
No, I'm going to say something.
Oh, sorry. Well, David, what did you
I was just going to talk. I think the advertising is very interesting, and there's a lot more attention than it's getting. I assume the reason we're seeing a big ramp up in advertising now is because of the expansion plans, and they're trying to mold public opinion. And some of the advertising is around the benefits, as we've heard, for the community investment that happens. Some of it is around the chances of winning and being set for life. But there's a sort of third stream in there which I find disturbing. The one that's been on the TV a lot recently is about the couple who break up in the restaurant. Some of you have probably seen it. Right.
they sing a song, that breaking up song.
The staff of the restaurant come and sing, instead of happy birthday, they sing you're breaking up. So the girl dumps the guy, and then the tagline is, okay, so go to the casino. And I don't know whether it's the girl going to the casino to celebrate getting rid of her loser boyfriend, or whether it's the guy, he's depressed after the breakup, he should go and gamble. It's a bit like you're depressed after your breakup, try Ontario wines. It
And
just
become
doesn't
more
seem-
depressed,
Yeah,
right.
it just doesn't seem like the right sort of context. Now we have a lot of experience thinking about the role of advertising in alcohol and tobacco. And lifestyle advertising, which paint these products as part of a happy, healthy, successful life, were outlawed in the state in terms of tobacco, and along the way to the complete ban of tobacco advertising. Some of the glitziest lifestyle advertising that comes into my door at home is from the LCBO. So I think the role of governments in promoting these activities is something that deserves an awful lot more scrutiny.
We call it alcohol porn in my household.
Yeah.
LCBO stuff.
Yeah.
Yes.
So I'm in the business of helping seniors. So my concern is that there's a large demographic of seniors who have a considerable amount of disposable income, and this whole idea of gambling is going to be marketed as a lifestyle thing, like has been mentioned before. I'm seeing them being very engaged. I'm also seeing another demographic within the seniors group that doesn't have the money.
Yeah.
And that's being pressured by federal changes to CPP, not having enough time. Well, I guess they can work a few years longer now, but we really don't have, or they really don't have an opportunity to make back that money should they happen to go into debt. So if I'm going to agitate around this, can you help me with some data, or is there anything out there that could help me educate the senior population?
Not a lot. I mean, I could look around. My immediate sense is not a lot, but I completely agree with you. I mean, there are bus tours that take seniors and that kind of thing, right? So, absolutely.
If I could add just anecdotally, I went down and visited the casino in Detroit and the casino in Windsor. So if you're there during the day, it is packed with seniors. They can cash their government checks. There's a place to go to, and you'll see people, particularly at the slot machines. It's not at the big tables.
Yeah.
The big tables are empty. It's at the slots, just putting in money, and the slots are just so addictive, as everyone knows, because it's just a nickel, a quarter, $1, and before you know it, the pot's going. The other thing that in speaking with the development, with the business community in both Detroit and in Windsor, part of bringing the casino in was to increase people coming downtown and spending money. I mean, 60% of Windsor is still empty downtown. I mean, it is a ghost town. Detroit is, I mean, you might as well be on the moon downtown. When you go to the casino, it is marginalized people who are gambling, and the money didn't come in that they had expected. So this whole economic thing, even the Martin Prosperity Institute came out and said, the money really isn't there. You're not going to get 300 million or 150 million or whatever you think you're going to get. So, but for seniors, it is it's a tough call. So,
Can I just quickly respond? This isn't the senior, but the Windsor case is interesting because, as you know, we had a temporary casino, then a permanent casino. Detroit responded to that by building 3 mega casinos. So you see the snowball effect that actually happens. We know right now, Ontario's losing revenues right now because Americans are not coming over. But part of the border, building of casinos on the border, is actually, it's quite shrewd, right? You get the money from the other country to come in, and you hope the social problems go back.
Yeah, well, that's often the sales pitch for casinos, is it will attract well-heeled people from out of country, out of state. But for most casinos, in the long run, most of their users are local. And it's the proximity effect. It's unless you're in Monte Carlo or someplace where you really are seeing a lot of international traffic, it's going to be local people. In terms of education, what we found in our research is education basically doesn't work very well. You know, there are lots of educational programs, and they're very popular with the industry as a way of addressing responsible gambling, what they call responsible gambling. But they don't work very well. Treatment programs, which is where roughly two-thirds of Ontario's investment in responsible gambling, responses to problem gambling goes, is also not very helpful. It may be effective for an individual, but our research showed that I think only 1% per year of people with problem gambling seek treatment, maybe 10% lifetime. So the vast majority of problem gamblers are never in a treatment program. And so the third stream of what you can do to address problem gambling is designing the gambling so that it's less likely to cause problems. All of those measures that we talked about, restricting access and so forth, which is where the industry doesn't want you to go, I don't think. You know, they're much more interested in putting out the pamphlets and having the education and having a treatment program available for those people who surface for treatment. But the really effective stuff is not what their priority is.
It's related to your comments about neoliberalism and the kind of economy we have. One of the arguments I like to make all the time is that gambling is effectively a tax on poor people. And recently I've seen arguments and some indication that in fact is not the case. So I'm wondering if you can give me some data to armor my argument. Not my argument, the argument that, you know.
You have to buy my book. I have some data in here. I would say it's not just a tax on poor people, it's a tax on everybody who gambles. It's an economic policy. I'm convinced the data shows it that gambling is a regressive form of taxation. So I don't know if you're responding to that in particular, but I've seen that kind of across the board.
That's what I'm responding to. There's other books I've seen that argue the opposite. That in fact, people with money are those who provide most of the revenue for gambling.
That may be possible, but most of the revenues come from the electronic games. The electronic games are what dominate the Vegas-style casinos. They take up most of the floor space. Up here, wealthy people who gamble, first of all, they're probably not playing slot machines. They might be playing poker or baccarat or something like that. That's entertainment. The further down you go, the more it becomes, trying to win money because you need it. So I'd have to actually look at the books that you're mentioning. I'm convinced it's regressive. As to the proportion, total proportion, I don't know, but I'm convinced it's regressive, though.
I know in the last couple of weeks there have been reports, one out of the UK, who was looking specifically at video lottery terminals, which, as we mentioned, are not at the core of the casino proposal for Toronto, and correlating that to postal codes and finding that the biggest revenues are coming from the poorest postal codes in the UK. And there was a similar study done out of Halifax, which, as Jim mentioned, is also inundated with these video lottery terminals. And again, they've correlated that the highest revenues are coming from the areas with the poorest postal codes in Nova Scotia. So that's...
The one I was looking was from somebody from the United States, from North or South Carolina. I think his name is Walker.
Okay. Yeah, David Walker, maybe.
David Walker.
Yeah. Our research also suggests that problem gambling is more common among low-income groups. Now, low-income groups have less money, so the financial contribution may be moderated somewhat by that.
We're coming up to the end of our session, but I wanted to just, if I could throw one last question. It's around, Dr. Kuhn, you mentioned that the recommendation that went through the Board of Health was the sort of double-barreled one, and the first one was that OLG not be invited to establish a casino in Toronto, and then the second part was around mitigation in the event that the first one is not adopted. And you listed some of the mitigation issues. Did you have any particular sort of recommendations on who would have carriage of those? Because again, it seems to me there's an inherent conflict if we're asking the OLG to mitigate against the very activity that they're seeking to promote. So would commission that would be, or an anti-gambling commission that wouldn't be.
Godfrey would be the chair.
We didn't make that kind of structural recommendation. I mean, all of the things that we said in terms of mitigation have been said before to LG and to the provincial government by people who are concerned about problem gambling, by the researchers and policy advocates. So there was nothing particularly new in those recommendations. It's a little unclear, other than the government clearly can set policy. The Alcohol and Gaming Commission can oversee. OLG can have policies which are more or less favorable to health. And OLG can, if as the plan currently is, it's going to contract with operators, OMG can impose conditions on operators. So there are mechanisms that exist. What the City of Toronto can do about it is interesting, and I honestly am not clear on whether the City of Toronto, as part of its, if it decides to give permission or agreement, concurrence with a gambling expansion in the city, whether it can place conditions on that. There has been motions which will be before City Council and Executive Committee about something called a social contract. This notion that if you're going to have a casino, there should be some measures in place to improve the social and health outcomes. What that would look like is not clear to me. I don't know what authority the City of Toronto has to require that. So.
Yes.
I was going to say, I do know that the city councillors are basically arguing over whether they can say yes with conditions or whether they must say no unless you do the following. I've heard from various councillors saying no, they can do this and no, they can't do that.
Yeah.
So councillors definitely don't know.
I think
and
there's a
they're
lack of
arguing
clarity.
over that.
Yeah, I think there's a lack of clarity about that.
And that presents an issue in terms of the consultation process, because we don't quite know in terms of the range of options. I mean, we obviously have an option to say no, but is there an option to say yes but or no but, as Mary has said, and what is that but, and who effectively enforces that but. In the case of some of the public health issues you mentioned, like smoking and alcohol, I guess public health has a direct role in smoking regulation. Is that
Yes.
So I don't know if that's a precedent for the city having a direct role in the regulation of gambling, but I don't think it has a direct role. Or does the city have a direct role in alcohol? Not really.
No, not a well, Toronto Public Health doesn't have a regulatory role in alcohol. We have an educational, promotional role.
Right.
But it's the Alcohol and Gaming Commission which has the regulatory role.
In the process, I would encourage everyone not to allow the casino to be a spectator sport or a form of passive entertainment that we simply watch and that we actually all get involved. So thank you, David, for bringing your expertise and comments. And Jim, thank you as well for the excellent analysis and putting this